Alright, so this is going to be a lecture video to make up for class being canceled on April 18th. This was not exactly what I had in mind for our last lecture, but obviously the weather had other plans for us, so we're going to make the best of it. I'm going to be covering the rest of the slides from Chapter 17 on disorders among children and adolescents. I have these slides posted for you. Also, as I said in my email, I'm going to be giving everyone full credit for the practice exam that we would have had in class today. So my plan was to finish this lecture, to answer any questions that you might have, and then do that practice exam. So if you have questions, please feel free to email me. Also remember that Exam 4 opens today, April 18th. It's going to open right after the time class would have started, which has actually already passed, but it's going to open at 1:45 on April 18th. It'll be open until 5 o'clock on April 24th. If you forget when this is, you can always refer to the syllabus. So after you take Exam 4, I'll be posting your grade in the class before the final exam. I'm going to get that grade by adding up your top 10 activity grades for up to 100 points, your top 4 exam grades up to 400 points, and then your extra credit up to the 15-point maximum. So I'll add those points together. That will give you a points total that will determine your grade. So after you take Exam 4, I will post that for you, and then you can make an informed decision about the final. If you're happy with the grade that is posted, you can keep it and use the final exam as your drop grade. If you do take the final exam, it will be in our usual place and time on April 30th. Now, as far as class on Tuesday is concerned, I will be there to answer questions you might have about grades, grad school, classes, etc., and then also to review for the final exam. If you're going to be taking the final exam, I strongly recommend you come that day, but if you don't need anything from me, there will not be any new material. It's not a required class day. Alright. Having said all of that, I am going to go through and discuss the slides that we would have covered in class today. So we were talking last time about neurodevelopmental disorders, so disorders that begin at birth or shortly after birth, and they impact things like attention, like memory, thought, behavior. And so last time we talked about ADHD. Today we're going to be talking primarily about 2 other neurodevelopmental disorders. We're going to start off talking about autism spectrum disorder, and then we're going to talk about intellectual disability. So when you think about autism spectrum, there are 3 major symptoms that we typically see. So first of all, there's going to be issues with social interactions, and then also problems with communication. This may be individuals who have very delayed communication, takes longer for infants and children to hit those milestones, and then continue to struggle with communication usually throughout the lifespan. And then also it talks about inappropriate responses to the environment. There are a couple of ways that this can play out. Sometimes people talk about repetitive behaviors or ways of interacting with the environment where they want to do the same thing over and over again, being very upset if something distracts them from their restricted interests, usually only interested in a few things, and put a lot of time and focus into those things, liking to have a routine, that kind of thing. But then also this can be a response to things like pain and temperature. Sometimes that can be reduced in individuals who have autism, but then also some other senses can create issues for them that it's just too much for them. So noises may be problematic for them, certain types of noises, certain types of textures, which can lead to kids having very limited diets that they're willing to eat. Sometimes having certain sensations from wearing certain types of clothes might bother them. So there's something about the way they interact with the environment that creates distress for them. So autism spectrum disorder is the term that we're using now. We will talk about how this has recently been updated in the DSM-5 coming up. But what we now think of as autism spectrum disorder was first identified in 1943. Certainly we have grown a lot in our knowledge and our research on the issue since then, but there is a lot left to learn. So research continues in this area. You'll see the criteria listed here. It talks about individuals having trouble with social interactions, communication, and then having these really restricted interests. Those are the core symptoms that we see. We do see that this is something that is more common in males than in females, as many different disorders in this set of slides were. So we've already talked about things like ADHD and conduct disorder, and intellectual disability that's going to be coming up is something we see more in boys than we do in girls. As far as the age when symptoms begin, usually the symptoms are recognized in those first few years. Most cases of autism are diagnosed by around 3, or maybe for a mild case that it's not actually diagnosed until a little bit later, 4 or 5. But the symptoms have been there before that age. But for a more severe case, sometimes it can be recognized as early as 6 months. I would say probably somewhere around 18 months is more typical. And so those early signs involve a lack of facial expressions and eye contact and attempts at communication, that kind of thing, that might cause a parent to be concerned and take their child to see a pediatrician. All right. Now, what we'll see about autism spectrum disorder is that some individuals, especially those who have milder issues, may find ways to cope and ways to reduce dysfunction and go on to lead typical lives. However, there is a large percentage of individuals with autism spectrum that go on to continue to have issues throughout adulthood. Although there certainly are therapies that we have that we'll talk about briefly that can be really helpful. We don't have a cure for autism yet, but we do have some behavioral therapies that can be really helpful both for a child as well as for parents and caregivers. We'll talk about those coming up. It talks about a lack of responsiveness, so this might look like ADHD sometimes. If you have a child that is not answering when you call their name, when you try to get their attention, then you might think that it's something like ADHD, but could potentially be autism spectrum. It talks about social reciprocity here. We're not born with a rule book as far as social norms are concerned about what is okay and not okay in society. But usually we learn that information from our interactions with other people about what is okay and what's not okay, how close do I stand to another person, what kind of eye contact is appropriate. So those social norms are something that we typically learn throughout interactions. Some individuals who have autism spectrum disorder in particular, may struggle with this, the social norm idea, and we'll talk more about why that might be in a second. Definitely, we can see communication problems, delay in communication, although it is important to note that different kids develop at different rates. And so a child that is having some delay in their speech does not necessarily meet criteria for autism spectrum, but this is something that might lead a parent to get an evaluation, which is not a bad idea. Of course, if we can catch something earlier, then we can get an individual into treatment sooner. We can probably have the best outcomes that way. One thing it talks about here is echolalia. This is repeating what you hear from other individuals. So sometimes if you say something to someone and they say it back to you, then you think they're agreeing with you, or at least they're expressing that they understand what you're saying. That's not always the case with autism. An individual might repeat back what they're hearing, but they're not really truly understanding you. This is just something that's a communication symptom for them. So, a few things to say about autism. First of all, back in the day, we thought that autism was more rare. You might have heard maybe like 1 in 100 kids, that kind of thing. Today, you're hearing numbers more like 1 in 59. When you see a disorder that is becoming more and more prevalent, there are several different potential explanations for that. I want to point out 3 briefly. First of all, it's possible that the disorder truly has become more prevalent. Like, individuals truly are experiencing symptoms of autism more now than they used to. And so that would suggest that whatever it is that's causing the disorder is on the rise, is increasing. That's a possibility. It's also possible that perhaps the number of people being diagnosed today reflects how many people have always had the disorder, but perhaps we weren't catching some of those cases. So maybe we've gotten better with our assessments, maybe our diagnostic criteria have improved, and maybe that's why we see this. And then a third option is that it is possible that a disorder has been overdiagnosed when you see an increase in the number of people being diagnosed. Likely with the case of autism, there's some combination of the 3 and maybe other reasons as well why we see an increase in the rates here. So as far as the DSM-5 is concerned, autism spectrum disorder is the general umbrella term under which other disorders have been placed. So in DSM-4, and then in the DSM-4 TR, text revision, so the version right before DSM-5, we had a category called pervasive developmental disorders. And in that category, we would have had autism, we would have had Asperger's, and then we also would have had childhood disintegrative disorder and Rett syndrome. And then pervasive developmental disorder, not otherwise specified. So we had a variety of disorders here, and they were all considered related. They were under the same category, but separate disorders. Some of those disorders, Rett's disorder, as an example, involved a child having typical development up until a certain point and then losing some of the abilities that the child had already acquired. So we're seeing similar symptoms here, but there are some key differences that were recognized. When it talks about autism versus Asperger's, with Asperger's we thought of it as a form of autism or similar to autism, has similar symptoms, social issues, communication problems, restricted interests, but they were more mild symptoms and also usually were not accompanied by intellectual issues. So intellectual disability that we're about to talk about in a few minutes is something that is commonly comorbid with autism, but the way that we broke this down in the DSM-4 is that if there was intellectual disability component, then that was more like autism. If there was not, then that was more like Asperger's syndrome. Now, in DSM-5, they decided that there is essentially not a difference between these different disorders, that they're all subtypes of autism, and therefore they've all been lumped together into autism spectrum disorder. So someone who had previously been diagnosed with Asperger's would now receive likely a diagnosis of autism spectrum disorder mild. So you'd have autism spectrum disorder and then you would label it mild, moderate, or severe. So whether we like it or not, this is the system that we have right now. And so that is the most up-to-date information that we have on classifying autism. Now, we asked the question, where does autism come from? I want to preface this by saying, first of all, we don't know, to be honest. We have some ideas about some potential causes, but we don't know for sure. And another thing to say, this is not on the slides, but I am going to mention this, and I mean, to be quite honest, this would have made for a lot of, I think, interesting discussion in class if the weather had not thwarted us there. But in psychology, we have a lot of topics that are a little more controversial, and I am about to talk about vaccines in autism, certainly a very hotly debated topic, a topic that, as you can imagine, is very emotional for a lot of people and very personal, so a topic that needs to be handled with care. But what I want to say is that it is not my job to tell you how to make medical decisions for yourself and for your family. I would encourage you to do your own research and to talk to medical doctors about that. It's my job to tell you what the research says, and that allows you to make an informed decision. So a while back, there was a research study that was put out that suggested a link between the MMR vaccine, so the measles, mumps, and rubella vaccine, and autism. As you can imagine, this created a lot of fear and anxiety in parents and caused a lot of individuals to choose not to vaccinate their children. What I can tell you now is that that particular research study has been discredited. There are various thoughts about whether it was just very poorly done or whether an individual may have intentionally misled people with it. But either way, since that time, there have been many high-quality longitudinal research studies that have failed to find any relationship between vaccines and autism, and there have been conducted. These research studies have been conducted, but they have not found any link there. Autism Speaks, I believe, is the name of the advocacy group, one of the advocacy groups that has come out and said that they are in favor of children being fully vaccinated. So just something to bear in mind there. We do not see a reason for concern with the relationship between vaccines and autism. Okay. Having said that, where does autism spectrum disorder come from? Well, first of all, when it talks about a theory of mind, here we're talking about a cognitive issue. And your cognitive development, when we talk about cognition, we're thinking about something that's a mental process. So thought, memory, attention, all of that, that's cognitive development that is impacted by your biological development. So if your brain has not developed, they don't have that biological development, then that cognitive development is not really possible. So there's a cognitive development issue here that seems to be caused by a biological issue. Like, spoiler alert, what we do know about autism spectrum disorder seems to point to a biological cause. But that biological cause may then produce a cognitive issue related to a theory of mind, saying that individuals who have autism spectrum disorder fail to develop a theory of mind. So when it talks about a theory of mind, we're essentially talking about having empathy and understanding another person's perspective, being able to take someone else's perspective. So when you have a conversation with another person, you have your perspective of what you're thinking and feeling and your experiences. But you also are aware that this person is coming to this conversation with his or her own experiences and perspectives, and you are paying attention to what the person is saying and how they're saying it, and you are able to a certain degree, deduce what they're thinking or how they might be responding to something, and you look for evidence to help you figure this out. So someone who has symptoms of autism spectrum disorder likely struggles with this. They have a difficult time predicting what other people are going to do, understanding what other people do, because it's very hard for them to take another person's perspective. So there's a cognitive issue here that we believe is caused by a biological issue. Now, there have been individuals who have suggested that family dysfunction may be a cause for autism, as in there's some kind of stress, marital conflict, or whatever that may be contributing to autism spectrum. Remember that we had these same issues with ADHD, people suggesting that family dysfunction could be causing ADHD. The research is similar for both in that it seems like autism and ADHD are not produced by environmental stress. However, environmental distress could cause these symptoms to get worse, but probably not something that caused the symptoms to start in the first place. So we think that autism spectrum disorder has a biological cause, and the reason we think this is because of the genetic links. So throughout the semester we've talked about a lot of different disorders that seem to be genetic. We study this by looking at, for example, family histories, by looking at twin studies, identical versus fraternal twins, by looking at individuals who've been adopted, how do they compare with their biological parents, even if they have not met their biological parents. So all of this evidence with autism suggests there's a biological component. You're more likely to have a child with autism if you have autism. Having said that, though, whatever the issue is can also be spontaneous. It can also come up even if there is not a family history of autism. So there could be other biological causes that are related. So there are some certain disorders, like for example, my daughter has tuberous sclerosis, or they're not really sure what she has, but they think she has tuberous sclerosis, and they told us when she was diagnosed that individuals who had tuberous sclerosis were more likely to have symptoms of autism spectrum. That has not turned out to be the case for my daughter, but there are certain disorders that put a person at a greater risk. Also, maybe substance use during pregnancy, or low birth weight, or some kind of trauma during birth. These are things that could be related to autism spectrum. Now, one thing that we see, if we're saying it's genetic, then what is actually causing the issue? What kinds of functional issues do we have here? Well, we don't know for sure, but there seems to be a relationship between issues with the cerebellum and symptoms of autism spectrum. So they call the cerebellum the little brain. Like in the back, underneath the cerebral cortex, you have the cerebellum. And the cerebellum has, for quite some time, been thought of as being mostly involved in motor coordination, balance, gross motor skills, fine motor skills, that kind of thing. And it does seem to be highly related. But recent research has suggested that there are also language issues and higher order processes going on here. So cognitive things that are going on in the cerebellum. There's also been some research with functional MRIs that suggests that individuals who have autism spectrum disorder may have some issues with their cerebellum, may have less gray matter, may have a smaller size overall. One study that I looked at was saying that the cerebellum was essentially flatter in individuals who had autism spectrum disorder, and the more pronounced these issues are, usually the more severe the symptoms are. This is a new area of research. There's certainly much work left to be done here, but we do believe there is some kind of biological cause. So we know that we can't cure autism. How are we going to help individuals and their families? Well, there are certain types of therapy that can be really helpful here. Usually we just isolate the core issues for this particular person and use things like reinforcement to help them build skills. So when it talks about communication training, we can help by using reinforcement. We can teach parents how to do these practices with their kids at home. There's also social skills training. The idea that we could help individuals with autism develop a theory of mind or be able to take another person's perspective just by practicing with them. Parent management training, I believe, is going to come up on another slide, but can be super helpful. In addition, sometimes psychotropic drugs are needed, so we're thinking about medications for other issues. So sometimes things like depression and anxiety can be comorbid with autism spectrum. Sometimes kids who have autism spectrum disorder have mood swings, and aggression could be possible. So this is something that could respond well to medication or to therapy or a combination. So when we talk about parent management training, certainly this can help a parent be able to meet their child's needs, be able to be the therapist for their child. So the actual therapist can only be with your child for 50 minutes, maybe once or twice a week. But as a parent, you spend a lot more time with your child. So if you have some training on how to help them practice social skills and communication, how to appropriately reinforce and punish and that kind of thing, then that can be really helpful for both the child, the parent, and the parent-child relationship. But also, it is stressful being a caregiver of someone who has additional needs, and so having individual therapy and a support group, which I think that is one advantage to today's technology, that even if you don't have other parents in the area that have kids with autism, you can likely find support groups that you can be a part of online. But then having group therapy or group kind of parent management training for parents that have similar situations can be really helpful for everyone involved. And self-care is huge here. Alright, so the other disorder we're going to be talking about today is intellectual disability. So there are two main criteria for intellectual disability. The person has to have an IQ of 70 or lower, and we'll talk in a second about what that IQ means. And then also they have to have deficits in adaptive functioning. Basically, they're having a hard time with day-to-day life. So this is going to be in multiple areas usually. So work problems, academic problems, relationship problems, self-care can be an issue here. Being able to live independently and safely may be an issue for individuals with intellectual disability. One thing I will say is that intellectual disability is the term that we use now. In the DSM-4, the term was mental retardation, but because of the stigma associated with that term, and I would strongly encourage you not to use terms in a flippant way, in a disrespectful way. That may be something that you've grown up hearing other people say. Please don't. Don't use that R word. Okay, just don't. That's just disrespectful. Just keep it classy. But when we're talking about intellectual disability, this is a term that we have shifted to try to avoid some of the stigma. Now, it talks about the symptoms appearing before age 18. Once again, the more severe the symptoms, probably the earlier they will be recognized. It may be after a child goes to school and is first compared with their same age peers. But if you have someone who is older, over the age of 18, and they suddenly start having issues, then that could potentially be substance use or traumatic brain injury or something like that. We wouldn't be thinking intellectual disability. Alright, so our criteria require a person to have difficulty in everyday functioning as well as a low IQ. So an IQ stands for intelligence quotient. So we have these intelligence tests that give you an overall score. And that overall score is made up of your performance on different subtests. So the Wechsler is the test that I am trained on. And I think we talked about the Wechsler. At the beginning of the semester, we talked assessment. I'm pretty sure we talked about the Wechsler. But there were 4 sub-areas on the Wechsler test. And there's a version for kids and a version for adults. Verbal comprehension, working memory, processing speed, and perceptual reasoning. And your performance on each one of those 4 areas then impacts your overall score, your overall IQ score. So some people may have a low score in one particular area, and that might just say, okay, we need to have some additional work here. But if a person has an overall lower score, then that suggests there could be something intellectual going on. So the Wechsler test, an average score is 100. So we're talking about someone being 30 points below average before we start making this diagnosis. Now, if someone had an IQ score of 71 or 72 and still had adaptive functioning issues, I'd probably still give that diagnosis because of the confidence interval, basically saying that our scoring is not perfect and so we could be 1 or 2 points off. But somewhere in that range, and for the purposes of this class, we'll use 70 as the cutoff. So having a low IQ, though, does not necessarily mean that the person has an intellectual disability. So, for example, I had a professor once talk about giving his mom an IQ test just because he was in grad school and he was practicing, and she made a very low score. However, she was very successful, ran her own business, had no problems in her day-to-day life. The thought was perhaps his mom had dropped out of school, and so maybe she didn't have as much opportunity to practice test taking or whatever the case may be. So if a person has a low IQ score, it's only an intellectual disability if this is also paired with difficulties with adaptive functioning. So you might get this from interviewing an individual or just from watching an individual or interviewing their parents, especially if you're talking about a child, but there are also standardized tests that you can use here. It talks about the adaptive behavior scales and the Vineland here that can be used that basically say, okay, this is what an age-appropriate level of adaptive functioning is expected. This is what we think you should be able to do. And then it'll ask questions like self-care, like can you tie your shoes? Maybe questions like, are you able to, take care of your teeth properly? Are you able to tell time on a watch? Are you able to count out change? Like those kinds of things that people are expected to be able to do. And so if you have problems in adaptive functioning and you have problems on your IQ test, then this says that a person might meet criteria for intellectual disability. Now, what does it mean for a person to have intellectual disability? You also see the term here, intellectual developmental disorder, which is another term equally valid. It doesn't quite roll off the tongue quite as much as intellectual disability. What we're saying here is this person learns slowly, not that they can't learn, but that they are learning a little bit more slowly than others. They may still meet the milestones other people meet, it just takes them longer to get there. They may need more individualized attention and care. So in addition to overall IQ issues, other areas that can cause problems here, attention, memory, planning, language, the more severe the intellectual issue, the more severe these other issues could be as well. It talks about individuals who are institutionalized are more likely to have these problems, so as one issue becomes more severe, the other issues probably do as well. But you can imagine if your IQ is measured on an intelligence test and you need attention to be able to take the test, and you need language, there's a language section on the test and there's a memory section on the test, and you can see how there would be a correlation between these skills and your overall IQ score. Now, individuals who have intellectual disability can fall in different categories based on the severity of it. The vast majority of people are going to fall into the mild case. So this is an IQ score between 50 and 70. So these individuals are still having, substantial issues. But first of all, in this range, you can see improvement with age. So it's possible that they learn what works for them, and then maybe once accommodations are made, they're able to learn a little bit better. They're able to catch up a little bit. But also, Usually with mild intellectual disability, it has more of an environmental cause than it does a biological cause, and maybe an environmental cause is easier to catch up on. So it talks here about poor and unstimulating environments. So there can be problems with parents, there can be problems with teachers, problems with school systems, lack of access to books. I have a thing about books and reading to my kids and giving books for presents for birthdays. Like, I'm that aunt that I buy my nieces birthday presents, always books, always books. And I buy a lot of books for my kids as well. And so there are things you can do to help stimulate the environment. The way one of my professors in grad school explained this was, he said that intelligence is like a rubber band. Like, you're given a rubber band. That's your nature. An amount of intelligence. But where you actually fall on the intelligence scale depends on how much you stretch that rubber band. So maybe, based on your biology and your genetics, you have a range between 85 and 95. You could be anywhere in that range. But if you have people read to you, and you have people work with you, and you put in a lot of effort, and you have good teachers, then you might be on the high end of that range. Or if the environment is not very stimulating for you, you might be on the lower end of that range. So you have a question of how far do we stretch. Maybe genetics does give you some limitations, but where you fall within that range of possibilities has a lot to do with the environment that you're in. So usually a milder form is more environmental, and then as it becomes more severe, usually it's more correlated with biological issues. So then we move up to individuals who might have moderate intellectual disability. So this is an IQ score between 35 and 49. So once again, in addition to assessing IQ, we're also going to assess adaptive functioning problems. These individuals may be able to do some basic self-care, may even be able to work. If there are some jobs that involve a lot of repetition, then they have people that work with them and help them train. Could potentially have a level of independence. But then as we move into more severe intellectual disability, where we have IQ scores from 20 to 34, these are individuals that usually will not be able to achieve any level of independence and will need a lot of supervision. As these symptoms become more severe, it may become more likely that an individual ends up in an institutional kind of setting, depending on whether or not they have family members that are able and willing to provide appropriate care for them. And then finally, very few, but 1 to 2% of all individuals with intellectual disability will fall into the profound category with an IQ score below 20. And so these are individuals who have very significant dysfunction here typically, and could be dangerous if they were in a setting where they weren't receiving appropriate levels of support, needing a very structured environment, a lot of hands-on care. So, as I said, the more severe the symptoms, the more likely it is to have a biological cause. Like, for example, Down syndrome is one potential biological genetic issue that can cause intellectual disability. Fetal alcohol syndrome is the most common preventable cause of intellectual disability. Remember our earlier conversation during the substance use lecture that there is no amount of alcohol that is considered really safe during pregnancy and breastfeeding. It's best to abstain from alcohol and other substances altogether. Talk to your doctor if you have other questions. Alright, so when we're talking about intellectual disability, as I said, many of them are biological, especially the more severe the symptoms. However, there can be a combination. So it could be that you have the genetic biological issue, but you have a fantastic environment that helps you be at the very top of your ability level. Or it could be that you have no real biological condition, but the environment is very poor and can cause your intelligence to be lower. So there is a relationship here between nature and nurture, as always. It talks about biological causes before, during, and after birth. I did mention, chromosomal issues here like Down syndrome or fetal alcohol syndrome as a genetic cause. But then also during birth, sometimes if there is a problem, like if placenta comes away, we have an abruption. If we have some kind of trauma while we're having difficulty getting baby out, if there's a lack of blood flow to baby's brain during birth, then this can also cause issues with intellectual disability, as well as other problems also. One thing I do want to say briefly is these slides don't cover learning disabilities, but with a learning disability, something like specific impairment, or a specific learning disorder with impairment in, and then you put in whatever it is, so specific learning disorder with impairment in math or impairment in reading. What you see there is a person who has an average or typical IQ, or maybe even above average IQ, but their functioning in a particular area is lower. So we'd be contrasting their IQ with what they're doing in a classroom, for example, or on an achievement test, and if they're not matching up, that could potentially indicate a learning disability, something we haven't had a chance to talk about, but just wanted to throw that out there. So for someone who has an intellectual disability, there are certainly things that you can do to help with that. So providing a lot of structure, providing training, a lot of hands-on learning, education, being patient, having as much one-on-one time as possible, breaking down a task into simple steps, and then repeating that over and over again can be really helpful. And so education is huge, but then education is also controversial here about what's the best way to educate someone. Of course, it's great if we can recognize problems early on and provide appropriate treatment there, but then the question is, what should we do for kids who have intellectual disabilities? Should they be in special education classes, or should they be in a mainstream classroom with other kids their age? So there is a real divide here, and I don't have the answer. As far as benefits of each go, having kids in a separate special education setting might allow them to have more one-on-one time with a tutor, smaller class size, fewer distractions, education that's tailored more to them. However, if you keep kids in the regular classroom, then that could potentially allow them to have more socialization. It could allow them to not have a negative self-fulfilling prophecy. So when you take someone and tell them, well, you have problems with learning, so you're going to be in a special education class, you might then set up this self-fulfilling prophecy where they don't believe they can be successful, or maybe even worse, where the teachers don't believe they can be successful. And so it depends on the situation. That's a case-by-case decision. Sometimes you hear about a least restrictive environment, like the least restrictive environment in which the individual can be successful is where they should be. So if they can be successful in the regular classroom, have them there. If they need to be in special education for a certain portion of the day, but they can be in a regular classroom the rest of the day, then that can be helpful too. When it talks about teacher preparedness, it is important to make sure that teachers know what to do and that teachers have appropriate expectations. Sometimes teachers think that learning issues are not there, and so they expect kids to learn the same way everyone else does. Or on the other side of things, they may feel like the problem is more severe than it truly is, and so they may have very low expectations for the student. Either way, this is something that can be harmful. Alright, now, as I talked about already with autism, people who have intellectual issues can experience other problems as well. There can be behavioral problems, aggression, violence issues. You can imagine it'd be very frustrating to have a difficult time expressing yourself, but then also emotional issues, depression and anxiety. So you may have individuals that need treatment for something else in addition to intellectual developmental disorder. So individual therapy can be great, group therapy where they can spend time around others that have similar experiences, and then also psychotropic medication is sometimes prescribed. You have to keep in mind though that sometimes an individual who has an intellectual disability might have other medical conditions as well. For example, kids that have Downs are more likely to have other health conditions and may need other medications for other reasons. Things like seizures and other issues can come up. So making sure that medications are administered in the appropriate way and making sure that they don't interact with each other in a negative way would be really important here. So one thing to say is that it's really helpful for adults with intellectual disabilities to have as much independence as possible. And for most of us, when we think about growing up, we think about getting a job. So there are certainly jobs that can be done by individuals who have intellectual disabilities. However, the problem is that you often need a very patient supervisor, someone who can put in a lot of effort into training an individual and helping an individual be successful, and that may just not be available. My husband was showing me a video of an individual who had Down syndrome, who had owned and operated his own restaurant and was giving out hugs as part of the menu that he was giving out. And I just thought that was the most incredible thing. And I wish that there were more opportunities for people to have training experiences. And I think a lot of the people who worked at these restaurants, there was another one as well, I think I remember seeing, a lot of people who worked there had special needs. And so that could be a really great place for people to learn and to train and to have some skills they pick up there. Yeah. Alright, so that is the end of the material for this class. So congratulations, you have finished abnormal psychology. As I said, I am going to be giving everyone full credit for this practice exam, and then don't forget that exam 4 is open now. It's going to close at 5 p.m. on Wednesday, April 24th. We will be having class on Tuesday, but it will be optional. If you don't have questions or need anything from me, then you do not have to come. If you're going to be taking the final exam, I would strongly recommend that you come to class on Tuesday. So let me know if you have any questions. It has been a privilege to teach this class this semester. And just let me know if you need anything in the future. You guys have a great day.